opponents of transplant medicine often accuse doctors of promoting organ donation for financial reasons. They argue that it is impossible to diagnose brain death with certainty. And if we assume the existence of a soul, do you think it is possible that the human soul is affected in any way by organ removal?
Dr. Eberhard, Sie sind Arzt und
Dr. Eberhard, you're a physician and president of Swiss Ions, and as such are intensively involved with the phenomena and questions surrounding near-death experiences. Today I would like to talk to you about a topic that is the subject of heated debate, namely organ donation. In my home country of Austria, as well as in France, Italy and Spain, a deceased person automatically becomes an organ donor unless they have expressly objected to organ removal beforehand. In Germany and here in Switzerland, the situation is different. But the call of an opt-out system is growing louder here. Conventional medicine generally favors this opt-out system because, according to the main argument, organs save lives, and there are far too few donor organs. However, you are rather skeptical about the opt-out system. Why is that?
Not because I am fundamentally skeptical about organ donation, but because the opt-out system involves infringements of personal rights that I consider to be excessive. We should protect these rights. In my opinion, the state should protect the citizens instead of removing this barrier. If someone has not decided to donate their organs during their lifetime and upon their death, a situation arises in which their relatives do not know what they wanted, then it should not be possible to simply make the decision to remove their organs. I think that goes too far. One must also ask oneself which people fail to make a decision during their lifetime. Often, these will be people who struggle with serious problems in life, who may not be able to read or write, or who simply do not want to deal with this issue. So, we do not know these people's opinions, but we assume that they agree to organ removal. At the moment, as in Germany, the following applies. Consent solution. This means that there is no living will and the relatives cannot be reached, i.e., if the deceased position of this issue is unknown, the organs may not be removed. With the objection solution, it is exactly the opposite.
So you are against the opt-out solution because of the infringement of personal rights. What is your general position on organ donation?
When it comes to organ donation, I am neither fundamentally for nor fundamentally against it. It is difficult. We are moving in a grey area here. Everyone's attitude to this issue can change over the course of their life. In my view, there is no fundamental right or wrong when it comes to such an issue. It is good to revisit it from time to time and rethink your own position. This question also affects me and my own family. When it comes to organ donation, I often think of the situation in the Third World, where these discussions do not exist. I once worked in a hospital in Tanzania. Every morning I had to walk past a girl whose kidneys were failing. She could no longer retain any protein. We didn't have enough protein to give her and too few diuretics. These were no longer of any use. The girl was bloated like a balloon and still completely lucid. If she had received an organ, she would have been cured within a few days. But as it was, she had to die a slow death. You can't just ignore this kind of problem when it comes to the pros and cons of organ donation. But at the same time, when I look at near-death experiences, for example, I also see another side that needs to be questioned. A second dimension that should also be taken into account.
You used to work as a doctor in large hospitals. Nowadays, opponents of transplant medicine often accuse doctors of promoting organ donation for financial reasons. Based on your experience, what do you say to these accusations? You are now independent of such large institutions. Have you encountered financial motivations?
No, I believe these accusations or suspicions have little to do with reality. Fundamentally, the declared and perceived goal of the medical profession is to heal and save lives. Who would personally benefit from an organ transplant? When considering such scenarios, one might assume that pharmaceutical representatives have financial motives because they sell immunosuppressants, which are needed after a transplant. This is a very small group of people, but they would have little opportunity to influence the number of organ donations or the procurement of organs. They would have to go into the intensive care unit and look around asking, where are your patients with good organs who are likely to die soon? They would also have to interfere in the doctor's discussions with relatives. Such assumptions are rather far-fetched. In practice, it is often not easy for doctors to talk about the possibility of organ removal. When they confront relatives with this question, it is not an easy task. It is stressful. In addition, organ donation, if it takes place, involves an enormous amount of effort. In a doctor's everyday work, organ removal is often an additional task that may even be performed voluntarily and without compensation. So it would be easier for us doctors in intensive care units if we could simply say, organ donation, no. That would be more pleasant overall. In this respect, I cannot accept this accusation. At least it does not correspond to my experience.
Opponents of transplant medicine repeatedly point to the controversial criterion of brain death. They argue that it is impossible to diagnose brain death with certainty. There are also stories of cases where, for example, accident victims who were about to have their organs removed woke up again. Or there are stories of people who unexpectedly woke up from a coma. What do you say to such stories? Are you familiar with such cases?
I have not looked into the veracity of such reports, but one thing is very clear. Coma and brain death are often confused. They are two different things. Coma is purely a description of a condition. Someone can be in a coma and their brain can still be completely intact. And a coma is not sufficient grounds for organ removal. There are very clear criteria. They all indicate that the brain must be truly dead and not just the cerebrum, but also the cerebellum and brainstem. There must be no chance that any of these functions could be restored. In a state of brain death, the patient is also in a coma, but with more pronounced symptoms. The pupils are fixed, and it is not possible to trigger any reflexes such as pain stimuli or reflexes in the eye and throat. All of this must be determined before organ removal, and often that is not even enough. A CT scan is required, an EEG is often performed, and cerebrospinal fluid can be removed. The question of whether this person is truly brain dead and has no chance of recovery is of utmost importance. Clarifying this issue is not something that is left to just anyone, at least here in Switzerland. There are specially trained doctors who are called in to help in cases like this. They have to check everything and decide if any more tests need to be done. It would be a nightmare for any doctor to go from being a helper, which is what they want to be, to a murderer. That can't happen. Doctors always work in a field of tension, of course. Every day in a doctor's life can bring decisions for which they must take moral and legal responsibility. Nobody wants to become a murderer. That would be a disaster. I don't think it happens in practice that someone is declared brain dead when they are not. That would be an absolute exception. What certainly happens much more often is that a careless general practitioner outside the hospital declares someone dead when they are not. I have seen that happen. And it happens even more frequently in the third world. It really does happen more often there that someone is declared dead when they are not. This is because the sure signs of death, which are actually very clearly defined there too, are simply ignored. I see this as a much greater danger than us doctors declaring someone brain dead when they are not.
But in principle, brain death can be diagnosed with certainty, right?
I think so, even if there are grey areas. Brain death is caused by direct brain damage. This can be a massive brain hemorrhage or a massive ischemia, i.e. a stoppage of blood flow. It can be trauma in which the brain is severely injured. Today, imaging techniques allow us to observe what has happened to the brain. This makes it possible to assess brain damage. Is the brain completely destroyed or not? The other cause is oxygen deprivation. So, for example, from a massive pulmonary embolism or a cardiac arrest, then no more oxygen reaches the brain. And we know that the brain is the most sensitive organ of all. That's why it doesn't take long for it to die. Images can also be used to prove whether the brain is dead. In this respect, I trust medical diagnostics. It may not guarantee 100% accuracy, but it can predict with almost 100% certainty whether someone is brain dead and cannot be brought back. This statement is not only important for possible organ removal, it can also be a matter of turning off machines when a person no longer has a chance. Whether the brain is dead is a question that often has to be answered independently of organ removal.
Even if your own experiences exonerate the medical profession to a certain extent, isn't the issue of organ donation rightly controversial because certain grey areas are not sufficiently discussed? Or, to put it another way, isn't the image of organ donation saving lives a little too rosy? Who came up with that saying?
Here in Switzerland, Swiss Transplant is responsible for organ donation. I don't know if the slogan "Organs Save Lives" comes from there, but in itself, it's not wrong. It's also different when a cigarette company advertises its products with the taste of adventure or something similar. In my opinion, such a slogan contains a kind of lie. You can't accuse Swiss Transplant, the organization responsible for procuring organs, of doing this. Of course, it focuses on the positive aspects, which certainly exist. On the other hand, of course, everyone is probably aware that organ transplantation is not a simple matter that everyone can agree on. We are caught in a dilemma between caring for others and the principle of not harming anyone. There are certain risks involved. But I see the main problem for doctors as being how to deal with relatives when it comes to broaching the subject of organ donation. After all, the relatives are already in a state of shock. They are dealing with a sudden loss and are now also expected to decide an organ removal without knowing what the person actually wanted. This also means not being able to say goodbye properly, because you can't just let an organ donor die because their organs are needed. This is a huge burden. And in this respect, I welcome the discussions about the opt-out solution to a certain extent. Not because I am a proponent of this solution, but because it gets people talking about the issue. Discussions about organ donation are extremely important. In my opinion, it is extremely valuable for each individual to form their own opinion on this issue and make a decision for themselves. The relatives should then also be aware of this decision, because that can be an enormous relief. If relatives know, for example, that my child wanted exactly that, that they wanted to donate their organs, then that can even be a comfort because this donation may allow another child to live on. If, on the other hand, I don't know what the relatives wanted, it can be very difficult. We have to ask ourselves these questions because there is currently a problem. We have the revolutionary and wonderful opportunity to replace a failing organ with a donor organ and thus considerably prolong a person's life. But this opportunity only exists in a tense situation, and the tensions associated with the issue are almost impossible to resolve.
As president of Swiss Ions, you have been dealing with near-death experiences for many years. Near-death experiences can be seen as evidence that human consciousness survives physical death. In your opinion, can anything be deduced from the statements of people who have had near-death experiences with regard to organ donation? And if we assume the existence of a soul, do you think it is possible that the human soul is affected in any way by organ removal?
I am very interested in this question. I find it very crucial and significant. So far, we have only discussed the physical side. The soul is generally neglected. And it was precisely the discussion about the opt-out solutions that prompted me to pursue this question. I contacted 4 leading near-death researchers in the USA, Raymond Moody, Kenneth Ring, Bruce Grayson, and PMH Atwater. None of them could name a single case in which this question was relevant, i.e., where someone had experienced something spiritual as a result of an organ transplant. Of course, one must also admit that this is not entirely surprising, because if someone is eligible for organ removal, they must be clearly brain dead, as I described earlier, and those who are brain dead will not be able to return and report on a near-death experience. Such a thing is practically impossible. One cannot report on a near-death experience and at the same time have undergone organ removal. However, during my research, I came across a case reported by the physician and near-death researcher, Dr. Erwin Brucker, in an interview. He knew of a man who underwent a colonoscopy, a colon examination during which a perforation occurred. This is a very rare complication. The endoscope had pierced the intestine. This is a catastrophe because the contents of the intestine then flow into the abdomen. The bacteria caused severe sepsis, as in the case of a ruptured appendix. The man became seriously ill, fell into a coma, and in this coma, he left his body and was then outside his body. It was very important to this patient to always stay close to his body. That's not always the case. The man then noticed the emergency surgeon, the chief physician, coming in. He followed him into a room and saw that he hadn't changed properly and thought, hey. And then he watched his operation, how they snipped out his intestines and placed them in a kidney dish. After the procedure, he continued to follow the doctor. He saw the chief physician and the senior physician talking, and the chief physician asked, "What about this patient's organs? Do we know anything about them? Has anyone consented to their removal?" This caused the man who was observing to panic and think, "This can't be happening. Now you want to give up on me." And that was the decisive impulse for him to return to his body. I'll show you now. In this case, someone who had a near-death experience was aware of something happening, but we have to consider that he was obviously not brain dead. If he had been brain dead, the surgeon would not have operated on him at all, and no one would have asked whether anyone had consented to organ removal, nor would the patient's organs have been simply removed. The chief physician did not know what the patient's prospects were, but he could not rule out the possibility that he would die and therefore ask this question. Of course, this story only indirectly shows that the soul is not indifferent to what happens to the organs of the body. Another case makes this clearer. One of the first near-death experiences I personally met was Stefan Jankovic, a Hungarian-Swiss architect. He was also one of the first people in Switzerland to publicly report on his near-death experience. During a discussion in a small group, He was asked about his views on organ donation. In response, he recounted his experience. After leaving his body, he saw fine threads, a kind of silver cord connecting him to his body. It was clear to him that when he died, these threads would break. As long as his body was alive, these threads would remain intact. Stefan Jankovic is not the only one to explain this. There are always near-death experiences who report a kind of silver cord, which some describe in detail. This phenomenon should give us pause for thought. What could it mean? Jankovic said he would not donate organs. He feared that if he donated a kidney, for example, he might remain connected to the recipient of the organ. Of course, we don't know whether such a connection is good or bad, if such a thing really exists. A connection with another person beyond death, then we simply don't know the consequences. I could imagine that it wouldn't be so bad. If you have a positive emotional connection with the recipient, you might even find it beneficial. Perhaps you find it nice to be able to help and support this person. But it could also be that the opposite is true and you don't feel comfortable at all and have the urge to withdraw. Perhaps the organ will then be rejected by the recipient. I have no idea. These are, of course, all just hypotheses. If one assumes a spiritual connection beyond death, many things are conceivable. It is also conceivable that organ removal could lead to severe stress without me being able to intervene. Anyone who believes in such a thing will naturally have to take this possibility into account in their decision. The belief in a conscious existence in the afterlife raises new questions. Everyone must decide for themselves.
For understandable reasons, we hear very little about organ donation from people who have had near-death experiences. However, there are also people with psychic abilities, and if we believe what they say, there are souls, i.e. deceased people, who for various reasons are considered earthbound, meaning that they cannot continue their development in the afterlife and are bound to the physical world. Can you imagine that organ donation might also lead to such a bond? Because the donated organ continues to live on in another body.
I understand such fears. The difference would perhaps be that in the case of such poor souls, as they are called in the Catholic Church, and also reported by other cultures, they then haunt because they cannot detach themselves due to their own decision. They may not know what is going on, but ultimately they are responsible themselves. This would be different in the case of bondage as a result of an organ transplant, especially if it was not wanted beforehand, which could happen more often with the opt-out solution. Such a thought can be disturbing.
One occasionally hears about the phenomenon of memory transplantation. There may be other terms for it. It refers to the phenomenon whereby the organ recipient suddenly exhibits characteristics or preferences of the organ donor. Do you think this is possible? Are you aware of any cases?
Yes, there is, for example, the well-known case of an Englishwoman who, according to her own statement, had only read trashy literature before the transplant. And then, as soon as she had the organ, she became enormously interested in Egyptology and classical literature. There are many such cases. Positive as well as negative changes are reported. But I question such reports because they are extremely difficult to assess. Changes can occur not only after organ transplants, but also after the implantation of a defibrillator, for example, which is just a machine. But these are very stressful procedures that can also lead to depression or hypochondria. There is always this fear: will my organ die? Will my device start working? Such tension can change people. In addition, strong medications are sometimes used, which can also affect the brain. And we also have to take the patient's expectations into account. There are placebo and nocebo effects. In their negative form, they are extremely powerful and can shape a person's perceptions. There is therefore little opportunity to objectively verify statements such as, "I am now a different person." We would have to conduct research on twins. One would receive an organ without even knowing it, and then we would compare the two. Something like this is simply unthinkable. All of this is purely hypothetical and will remain so.
Earlier you mentioned the silver cord. This is a term known from the Bible that describes the connection between the soul and the body. Now, there is a theory that as long as this subtle silver cord has not been severed during the dying process, a certain degree of pain perception is still possible. This means that the organ donor could still experience the organ removal as painful in some way. Do you think this is pure speculation, or is it possible?
That's a delicate question. In itself, the experiences of people who have had near-death experiences allow for different assumptions. There are experiences like the case I described earlier. Someone desperately wants to return and not die. But more often than not, people show an enormous and astonishing indifference to their bodies as soon as they see them from the outside. They are not interested in them at all. They recognize them. That's my body, I'm dead. And they may even observe the resuscitation, but then they simply move away. They do not report seeing a silver cord. Some of them have transcended experiences in which the body no longer plays any role at all. So there are both possibilities. It is possible that the idea of a connection to the body is much more stressful for us than it is for a dying person. I believe that when a dying person can or wants to enter this other world, the connection to the body, at least it seems, is often very loose or no longer exists at all. Buddhists who have studied this topic extensively would probably agree with this statement immediately. The condition of the body probably also plays a role in the dying process. It may be that the connection to the soul is lost as soon as the brain is truly dead, when only machines are keeping it alive. But we do not know. Dying is often associated with pain. But for me, that is not an argument against organ transplants. It may be that organ removal also has adverse effects, but we always have to reckon with that in medicine. But returning to the idea that an emotional attachment to an organ could remain, if that is the case, I trust that this circumstance can also have a meaningful effect. In the positive case, that the organ recipient grows from it, that the organ really helps them in their development, that instead of dying, they can experience new things that help them move forward. For me, the possibility of an emotional attachment to an organ does not necessarily lead to a rejection of organ transplantation.
To summarize, have I understood you correctly? Spiritual aspects are worth discussing, but because they are highly individual, they are not suitable as a guideline for deciding whether organ removal is right or wrong.
Exactly. The problem is reflected in the decision for relatives not to say goodbye as usual, but to be able to save a life instead. And if one assumes the existence of a higher non-material level, there are also positive and negative aspects to consider there. I can detach myself from the body, and if I am no longer interested in it, I can also agree internally that organs be removed from it. On the other hand, I may find it catastrophic to see what is happening to the body. The same applies to the idea that there could be a certain attachment to the body. It can be positive, but it can also be stressful. The dilemma remains. There is no clear yes or no, and in this respect, the decision to donate organs must be left to each individual. That is why I am wary of making a recommendation. I think it is definitely an individual decision. But let us consider the case described earlier. Someone is shocked because, in an out-of-body state, they hear doctors talking about removing their organs. Does this argue against organ transplantation? I would be skeptical, because in such cases, if they exist, we are also faced with the question of how useful life support equipment is. The patient can only continue to live because machines are working for them. So, should we keep them alive even though their body is practically dead? There are such ideas. They are often religiously motivated. But I find them problematic because the machines could also create a kind of bond between the soul and the body. I could use the machine to bind someone to their body against their will. I don't think something like that should be supported. Of course, the statement is also very bold, but when it comes to whether or not to remove organs, it is even more difficult because ultimately, we are always faced with the decision of either turning off the machines without removing organs or removing organs beforehand. That is the point we reach. But it is unreasonable to expect either the relatives or society to accept this decision being made on financial grounds. There is no price tag on human life. Nevertheless, there is a limit beyond which society is overwhelmed by what it can afford to provide in terms of intensive medical care. This can be estimated at around 100,000 Swiss francs per year, but if someone is to be kept alive by machines in intensive care, perhaps for decades, then it would cost much more than 100,000 Swiss francs per year. In this respect, it is indeed also an economic question. Can this be expected of society? Just imagine what that means, 100,000 Swiss francs per year. How many people have to work to keep someone alive who no longer wants to live? In this respect, material aspects must also be taken into account in the decision. Apart from the spiritual aspects, such as the question, is it actually beneficial for a soul in the afterlife to remain connected to the physical body?
We have talked about physical, mental and spiritual aspects. In summary, how would you assess organ donation? Is it a curse or a blessing?
Perhaps the curse lies in having to decide between curse and blessing, because we think it's an either-or situation. But the issue of organ transplantation shows that it's not so easy to categorize everything as good or bad. Life is much more complex than that, and that's a good thing. Organ transplantation is not the only dilemma in medicine. Many people are also familiar with the dilemma surrounding radioactivity, for example. The discovery of radioactivity has saved an incredible number of lives. Before magnetic resonance and ultrasound technology, we had no way of looking inside the body other than with X-rays. And these X-rays have advanced our knowledge enormously, preventing diagnostic errors and thus indirectly saved an enormous number of lives. X-rays are used to kill tumors and thus save lives. At the same time, as everyone knows, radioactivity is deadly. It can cause tumors. Here too, the curse and the blessing are closely related. But it would be foolish to simply reject everything to do with X-rays and say, I don't want them.
Discussions on the subject of organ transplantation are still very emotional and controversial today. Some see transplant medicine as a fundamental aberration, keyword modern cannibalism. Others basically only see the advantages: saving lives, medical progress, helping sick and suffering people. Do you see any possibilities for building bridges between supporters and opponents of transplantation?
That's difficult. There are two aspects to consider. On the one hand, there is the individual decision. This requires education so that individuals know as much as possible about the subject. Everyone should be obliged to find out about the possibilities of organ transplantation and make their own decision. I consider this to be very important, especially for relatives. It is not good if they have to make the decision. It is much better if they know the decision of the deceased or dying person. That is a great relief. It would also be beneficial for the organ recipient to know that the donor did so voluntarily. It is important that the decision to donate organs is made voluntarily. And that brings us to the second aspect, the legal one. I also reject the opt-out solution because it would probably weigh on me as a recipient if I did not know whether the donor wanted the organ to be removed. The fact that there is too little knowledge about the subject is not necessarily due to a lack of information, but also to the problem that it is taboo. Behind this lies the fear of death. This can lead to a superstitious feeling. If I talk about it in my family, I could give the impression that I approve of it, or something could happen because I'm talking about the subject. So I prefer not to bring it up, because I don't want to burden my loved ones. But it is precisely this attitude that can lead to a great burden. When it comes to making a decision, in my opinion, it would be much wiser to take the plunge and deal with the subject beforehand rather than sweeping it under the carpet. And I also see a very important bridge being built by near-death experiences. In my opinion, these help enormously in reducing the fear of death. In this respect, this channel also contributes to the topic, and I think it's important for viewers to stay tuned. My conclusion on organ donation: you need to be well informed and be able to decide for yourself. That's important.
The topic of organ donation is probably so controversial because there are no simple guidelines that individuals can follow without any ifs or buts. Everyone is called upon to make their own decision. For this reason, Dr. Eberhard, I would like to thank you very much for your comments. I think that the nuanced thoughts you have expressed not only encourage reflection, but could also contribute to the discussions on the opt-out solution. With this in mind, thank you very much for the interview.
Danke, Herr Huemer.